2 out of every 3 people who receive health insurance benefits through the FEHB program are covered by Blue Cross and Blue Shield. The federal employee program under Blue Cross and Blue Shield consists of 3 plans: the basic option, the standard option, and Blue Focus. The basic and standard plans dominate in popularity. So in this video, we'll mostly focus on highlighting some of the main differences between these 2 plans across 5 key areas. We'll first look at cost differences. Then we'll review their differences in provider coverage, drug coverage, and overseas coverage. Lastly, we'll explore how these plans work together with Medicare. I'll also encourage you to stick around until the end of this video, as we'll cover a few key points about the Blue Focus plan for those who may be looking for a more budget-friendly option. But before we dive into the details, welcome to the Money Briefing. My name is Jerome Harvey, and I'm with Fedway Financial. On this channel, we cover topics related to personal finance, federal benefits, and retirement planning. So if you find this video helpful, please consider sharing and subscribing. Identifying the right health insurance is extremely important, but it's not the easiest task to complete, especially when there's changes in your family status, work status, or medical status. In 2024, there are nearly 160 FEHB plans to choose from, but the majority of federal employees and retirees choose to enroll in either the basic option or standard option with Blue Cross and Blue Shield. And there are many reasons to do so. Both plans offer comprehensive medical coverage, access to a large provider network, and various rewards and discounts. However, one of the biggest differences between the 2 is cost. The bi-weekly or monthly premiums that you pay usually change each year, and the new rate schedules are typically released around October. In 2024, the annual premium for the basic self-only plan is approximately $1,400 less than the standard plan. If you're using the Self Plus One coverage, you'll find the premiums for the basic option to be about $2,500 cheaper for the year. Meanwhile, if you're enrolled in the Self and Family plan, you'll pay roughly $2,800 less in premiums for the year with the basic option. The premium rates between the 2 plans are the primary difference from a cost standpoint, but other cost-sharing factors such as deductibles, co-pays, co-insurance, and out-of-pocket limits can also come into play. The basic option does not have a deductible, and you pay for most services through a set co-pay. The standard plan has a deductible, and it uses a mixture of co-pays and co-insurance depending on the type of service that you receive. Most of the standard co-pays are about $5 to $10 less than the basic co-pays, and their standard option also has a lower out-of-pocket limit. Even though there are some cost savings with the standard plan, generally the standard option will run you about $1,000 to $2,000 more each year, depending on the number of people that are covered under your plan and your usage of services. Another major difference between the basic and standard options are provider coverage. Blue Cross and Blue Shield operates as a preferred provider organization, or PPO, which means it has a network of doctors, hospitals, and facilities that have contracted with them to provide medical services at a discounted rate. With the basic option, you must go to a doctor or facility in the network to receive benefits. However, the standard option allows you to go out of network, but you'll typically pay more for out-of-network care. Blue Cross and Blue Shield currently has a network of about 2 million doctors and hospitals, as well as 55,000 retail pharmacies. Based on the size of this network, most families can find adequate doctors in facilities within the network. But if you live in a very remote location, or if someone in your household has medical needs that routinely require out-of-network services, the standard option may be a better fit. Additionally, another crucial difference between the 2 plans is drug coverage. The basic option has a managed formulary, which means it covers most FDA-approved drugs. while the standard option has a comprehensive formulary, which means it covers almost all FDA-approved drugs. It's also important to note if there are prescription drugs that are not covered under the basic plan or are excluded from the standard list, there may be other drugs available that treat the same condition. So if any of your medications are not listed under a certain plan, you'll want to check with your doctor to see if there are any generic or brand name alternatives to fit your needs. Both plans are organized into 5 drug tiers. Usually, the lower the drug tier, the less you pay. In addition to having a wider coverage of drugs, the standard option offers all members access to the mail service pharmacy program, which delivers prescription drugs right to your home. This benefit is only offered to basic members who have Medicare Part B. The mail service pharmacy program not only provides convenience, but it can also be a significant cost saver. This program usually gives up to a 90-day supply versus a 30-day supply that you get at a retail pharmacy. For example, let's say you have a prescription that has a $5 copay. With a 90-day supply, you only have to refill your prescription 4 times per year, which will cost you a total of $20. With a 30-day supply, you must get 12 refills per year. This will cost you $60 rather than the $20 with the mail delivery. One of the other major health benefits that has been expanded for standard members is infertility treatment. The standard option will cover up to $25,000 annually to get any assisted reproductive technology procedure, which includes IVF treatments and several other procedures. A fourth key difference between the two plans involves overseas coverage. Having international coverage is very important for those who travel abroad or who plan to live overseas while working or during retirement. All Blue Cross and Blue Shield plans offer healthcare benefits overseas, and you're generally covered for all the same services that you have in the US. Additionally, you can use any licensed provider overseas. However, Blue Cross and Blue Shield provides access to a network of doctors and facilities through their overseas partnership with GeoBlue. This network of providers also accepts direct billing arrangements, so you don't have to worry about paying for your services and then filing a claim for reimbursement. If you have the basic option, you will have to use a network provider to get certain fees waived, such as inpatient hospital care. But if you have the standard option, you can go to any provider and still get the inpatient fee waived. Standard plan members will also get their deductible waived when receiving or using overseas services. The last difference that I want to discuss is how both plans coordinate with Medicare. If you have Blue Cross and Blue Shield and Medicare while you or your spouse is still working, then Blue Cross and Blue Shield will be your primary insurance. In this situation, you'll continue to have all the same normal benefits. But once you or your spouse retires, Medicare will become your primary coverage and Blue Cross and Blue Shield will be secondary. When Medicare is primary, Blue Cross and Blue Shield offers several additional benefits. For example, when you combine both coverages, Blue Cross and Blue Shield will essentially eliminate your out-of-pocket costs for covered medical services. They will pay for your doctor visits, hospital visits, and other types of medical care that you receive. You will mainly just be responsible for paying your Blue Cross and Blue Shield premium, your Medicare Part B premium, and your pharmacy cost shares. One of the best advantages of the basic plan is the Medicare reimbursement account. Basic members can receive up to $800 back per year for paying Medicare Part B premiums. And if your spouse also has Medicare, then you get up to $1,600 back each year. The good thing is that you can get this benefit even if Medicare is not your primary coverage, and you can use the reimbursement on anything that you like. Additionally, if you submit your claim and proof of payment online, you usually receive your funds within a few days via direct deposit. Unfortunately, there is no reimbursement program for standard members. Another benefit of having Medicare along with Blue Cross and Blue Shield is the FEP Medicare Prescription Drug Program. This is a newer benefit for both basic and standard members that allows you to get additional covered services and prescriptions and receive lower cost shares for higher priced drugs. Under this specific program, there are 4 drug tiers instead of the traditional 5 tiers. There's also an annual cap for prescription drugs. With the basic option, the most you would pay for your prescriptions for the year is $3,250 per member, and with the standard option, the maximum is $2,000 per member. As I mentioned earlier, the federal community enrolls in the basic option and the standard option most often, but the Blue Focus plan could be a good fit for some federal employees. The Blue Focus plan offers many of the same benefits as the other 2 plans. You get free preventive care, overseas coverage, and you can use any provider in the network. On the downside, the formulary for the prescription drugs is limited, and you have a higher deductible amount and out-of-pocket limit. Therefore, the Blue Focus plan is best suited for those who don't use their healthcare benefits that often, don't have a need for any out-of-network providers, and have very little to no prescription drugs. One of the advantages of the plan is the low premium. The Blue Focus option is about $40 cheaper than the basic option on a bi-weekly basis. This adds up to a savings of roughly $1,000 for the year. When evaluating what plan is best for you, it's good to keep in mind that you have the opportunity to switch plans every year during open season, or you can make changes to your plan if you have a qualifying life event, such as getting married, divorce, or having a baby. Overall, Blue Cross and Blue Shield offer some great plans to support the healthcare needs of you and your family, whether you use it as a standalone coverage or in combination with Medicare. If you've received any value from this video, please click the like button. You can also subscribe to our channel to get more content like this. If you're interested in seeing how we help our clients at Fedway Financial get the most out of their money and federal benefits, please visit our website at www.fedwayfinancial.com, or you can schedule a free consultation by clicking on the meeting link in the video description. Thank you for watching, and we'll see you on the next Money Briefing.